Bismillahirrahmanirrahim. Assalamu alaikum. I am Tarab Khan from 4th year morning, and the topic which I am going to present today is garlic from the chapter Herbs and Nutrition Supplement. Now, what is garlic? Basically, garlic is a herb which is known as Allium sativum or stinking rose. Garlic is commonly used in our foods and as flavoring agent. Now, when used as food, the garlic is not likely to produce health benefits or side effects. But when this garlic is used as a medicinal product, it may produce both desired and unwanted effects on the body. Here we are focused on garlic as a human supplement or as medicine. Garlic products are sold as health supplement may vary widely in amount of allicin. Now what is allicin? Allicin is the active ingredient which is present in garlic. Allicin is unstable and can be reduced in garlic products that are aged to reduce odor. Odorless garlic may contain little or no allicin. The lower the amount of allicin, the less effective garlic products might be. A variety of organosulfur compounds in garlic have also found to produce therapeutic effects. Now, how does it work or the mechanism of action? Diallyl sulfide oxide or allicin here is responsible for characteristic odor of garlic or some garlic products which are dried garlic powders. They may be standardized to this ingredient or the precursor which is known as allicin. Now, this Ellen, specifically when the garlic bulb is crushed, chewed, or chopped, the odorless precursor that is also alanine, allen or S-allyl L-cysteine sulfoxide is exposed to an enzyme called allinase. Allinase and then this allinase convert it into allicin or other thiosulfonates compound. This allinase enzyme is very unstable and that it can be destroyed by heat or stomach acid. This allicin is oil soluble and highly volatile, and it is then easily converted into odorless oil soluble compound which are known as diallyl sulfides, DAS, vinyl diethins or ajoins. Now, what are the health benefits which are associated with garlic? Garlic is taken orally by mouth and has been used as an alternative medicine as a possibly effective aid in treating high blood pressure, in treating coronary artery diseases, in treating stomach or rectal cancer, or preventing the tick bites. Other health benefits of garlic includes garlic is also used to treat high cholesterol, stomach ulcer that are caused by H. pylori, cancers, or circulation problem in the legs. However, research has shown that garlic may not be effective in treating these conditions. Garlic can also be used as an anti-infective, and it has antibacterial, antifungal, antiprotozoal and antiviral properties in vitro. Other uses has not been proven by research, but it is also included in preventing the common cold or improving the urination which are caused by enlarged prostate gland. Now we came here for the case study. It says that MJ weighs 105 kg and is 6 feet tall. He rarely exercises and eats a diet high in fat. His medication profile indicates that he has been taking benazepril, Lotensin 10 milligram oral for daily for 2 years. MJ's doctor has recommended a diet and exercise program. On questioning, he recalls his cholesterol values from last month. Total cholesterol level was 290 milligram per deciliter. High density lipoprotein cholesterol was 30 milligram per deciliter. LDL-C was 230 milligram per deciliter and triglycerides were 150 milligram per deciliter. Now the question is, can garlic significantly improve MJ's lipid profile? The second question is MJ a candidate for garlic? And the third question is asked, is MJ decides to purchase garlic and tells you that he will also begin the diet, an exercise plan his doctor recommended. MJ is taking benazepril or tensin for hypertension. Do you have any additional questions or concerns? Now, making the soap notes, first of all, for subject, the gender MJ. MJ is a male with weight 150 kg and 6 feet tall. Medical history, according to the medical history, according to the case study, says that the MJ is taken benazepril, which is antihypertensive drug, for 2 years almost. So he has hypertension complaint. Also, his reports tell that he has hyperlipidemia. Lab reports are basically very high. A normal cholesterol level is less than 200. Here we can see it is 290 milligram per deciliter. The LDL level is also 30 milligrams, which is major risk factor for heart diseases. The LDL level should be less than 100, but here it is 230 milligram per deciliter. The triglycerides should be less than 150. It is on borderline. So as the reports tell, the cholesterol level and the LDL level are uh, very high. The assessment is MJ is overweight and has hyperlipidemia and hypertension, which is due to the intake of high fats in diet and the absence of exercise in his daily routine. Now, for part one plan, which is ask that MJ is can garlic significantly improve MJ's lipid profile. So, according to research, when a trial was randomized on 192 adults and was given with garlic, and they have a cholesterol level of 130 to 190 milligram per deciliter. They were given 4 grams of raw garlic, or some were given 1400 milligram of standardized garlic powder with proven allicin release ability garlicin, and some were given 1.8 grams of aged garlic extract keolip and placebo for 6 months. And none of the garlic groups have significant benefits on LDLC as compared to placebo at the end of the study point. But studies also shows that in vitro, the inhibition of hepatic 3 hydroxy 3 methyl glutaric coenzyme A, which is also known as HMG CoA reductase, has been observed, and it is considered as the primary mechanism for garlic anti-hyperlipidemic action. So it depends on the patient ability to take the garlic. He can or he cannot take garlic, but the study shows that they do not have any significant benefits. The second question, which was asked, that is MJ a candidate for garlic? So MJ should be advised that the dietary modification and exercise are the best ways to reduce cholesterol without pharmacotherapy. His high total cholesterol and LDL and low HDL are not likely to significantly lowered by limited effect, if any, of garlic. As already noted, that the benefits of garlic remain questionable because only a small number of patients have been evaluated. Furthermore, its benefit of the people who are already modifying their diets may be insignificant. The third question is MJ decides to purchase garlic and tells you that he will begin the diet and exercise. So, what MJ is taking benazepril and locentin for hypertension. Do you have additional questions or concern? For part three, they are asking about the drug-drug interaction between the garlic and the drug he is already taken, which is benazepril. So, according to research or according to trials, there has been no drug-drug interactions. But MD should be aware that few trials show that the garlic is responsible for lowering the blood pressure. So However, it is unlikely that the effect of garlic on BP are clinically meaningful. So MJ should not have to monitor his BP more often than usual after initiating the garlic supplement. That's all. Thank you so much.